Hello and welcome to the Arise interview, 60 minutes of multifaceted discussion where we speak to the newsmakers as well as ordinary people doing extraordinary things, and we feature the voices at the heart of the stories. I'm Charles Anyekolu. Coming up in the next hour, doctors in Nigeria who are on the front line of the fight against COVID-19 have voiced serious concerns about the government's spending priorities. They say that if the disease takes hold, they wouldn't be able to deal with the most serious cases because some states don't even have a single ventilator. They've also expressed worries about the stress and psychological burnout that can happen to frontline health workers. We'll speak to the national president of the Nigerian Association of Resident Doctors. And later, as billions of people around the world continue to live under some form of lockdown with movements restricted and lives turned upside down, we'll get a snapshot of what isolation looks and feels like from the perspective of one top African Caribbean journalist who has himself been under strict quarantine over concerns of underlying health issues. All in a moment. Now, doctors in Nigeria who are on the front line of the fight against COVID-19 have voiced serious concerns and unease about a raft of issues, much of them to do with the government's spending priorities, the consistent lack of personal protection equipment, and the fact that some of them are falling ill physically and psychologically and even dying. It comes as several African countries, including Nigeria, have reported a big surge in cases of coronavirus. The doctors are particularly dismayed by what they say the government in states like Nasarawa in north-central Nigeria has chosen to prioritize at a time when there are major worries about the spread of COVID-19. They say that if the disease were to take hold, they would not be able to deal with the most serious cases because the state doesn't have a single ventilator. News emerged last week that the Nasarawa state government has bought a new fleet of cars for lawmakers in the state, but the governor of the state, Abdullahi Sule, said the cars were ordered for the lawmakers before the outbreak of the pandemic. He also said that ventilators have been ordered and should be arriving very soon. Here's the governor speaking generally about how he intends to deal with healthcare in Nasarawa state.
I'm not looking at building more hospitals as a solution, because that is actually the most important is to find the root cause and see how you can address them, rather than just providing the solution constantly. Every time somebody is sick, go to the hospital. Or you have to take some of these health facilities, to their own areas. There are so many deaths that occur as a result of not having a healthcare facility close by. So again, these are the areas where we have to provide. And these are basic services that government should provide anyway.
Well, from all the concerns raised by Nigeria's doctors who are on the front line of the fight against COVID-19, let's speak now to Dr. Aliyu Sokomba, president of the Nigerian Association of Resident Doctors, who joins me in the studio and is a safe social distance away. Thank you for coming in.
Thank you very much for having me.
And I want to say this on the record. We're very proud of the work that you're doing and your team, your Association of Resident Doctors are doing, because without you, we wouldn't have a hope at all of getting past this awful disease. So thank you.
I want to appreciate you for the recognition.
Thank you for coming in.
Thank you.
Now let's talk about what you've raised concerns about. And you spoke specifically about the Nasarawa state government spending millions of naira buying new vehicles for its lawmakers in the middle of the coronavirus pandemic, despite the fact that the state doesn't have any ventilator to deal with COVID-19. The governor has said that the cars were ordered before the advent of COVID-19. He also said that they have in fact ordered ventilators. What's your response to that?
Thank you very much. With regard to what is obtainable in Nasarawa state, I want to state here that it's not just peculiar to Nasarawa state, it's what is obtainable in most state institutions and in fact even the federal institutions. We have a situation where we have our health system being neglected for decades, and we are currently facing the consequence of the neglect. So what we have in Nasarawa states is a situation where, like most state institutions have been neglected. I want to differ a bit from what the state governor has stated as his reason for the purchase. I want to state here that before the COVID-19 outbreak, there was and there would continue to be the need for ventilators in institutions like the Lahatu Araf Specialist Hospital, being the only state-owned government hospital in the state. So it is not COVID-19 that is necessitating the need for ventilator in the states. So the rationale that those vehicles were purchased long before COVID-19 broke out, I don't think is good enough, because even before COVID-19 broke out, there was always the need for hospitals to be equipped, to be ready. Though there has not been any recorded case of COVID-19 in Nasarawa State, but I think that having recorded the first case of COVID-19 in Nigeria for the past 9 weeks, it's an opportunity for any state government that is serious to boost their emergency preparedness and ensure that the state is ready should there be outbreak in the state. And of course, nothing stops Nasarawa State from recording cases, especially considering the fact that the neighboring states to Nasarawa State are already recording cases, Abuja, Makurdi, and so on and so forth. So I think it is an opportunity for Nasarawa State, if they had considered it a priority, to boost and strengthen the health system in the state and in preparation for the outbreak should it occur in the states.
And for any outbreak, I mean, it doesn't have to be COVID-19.
Yes, it doesn't have to be COVID-19.
But why do you think that they don't make that a priority?
Well, for obvious reason. Before now, government officials and elites in Nigeria had resorted to seeking healthcare services abroad. And for this reason, they have allowed the weak and the poor to continue to grapple with the dysfunctional, weak health system. And so because they don't seek care from these institutions, they never saw the need to strengthen the health institutions that are present in this country. And for some time now, my association and several other health organizations have been clamoring that our health institutions should be strengthened. To start with, the budgetary allocation to our health institution is nothing to write home about. It has always been hovering about around 4.5% or so, and as against the 15% that should be recommended, that has been recommended by world leaders, African leaders in a meeting that held here in Nigeria. So that goes to tell you that even the leaders in this country have given up on strengthening the health institution, perhaps most importantly because they don't seek care from this institution. And what's worse is that even with the advent of this COVID-19 that has blocked their access to seeking care abroad, one would have thought that it is an opportunity for them to reflect on the need to strengthen their own health institutions in the country. And unfortunately, that's not the case.
Well, certainly the federal government appears to be doing something. And states like Lagos, they really have no choice because, it's upon them. And they're the epicenter of the outbreak in Nigeria. So they appear to be doing something, but that's clearly not enough because you need it to be done across the board and across the country. And something else I noticed the other day, because I interviewed the Minister of Water Resources. His central complaint was that the federal government keeps trying to get the states to do things and the states are just not doing them. For example, water is apparently under the purview of the states, but they control the water boards and all that, but they're not doing enough to ensure that water is an essential part of the fight against COVID-19.
Yes, I must commend the efforts of the Lagos state government in this fight against COVID-19. I also want to say that the federal government is making efforts to see that this disease is contained, but for obvious reasons, their efforts is not good enough. You will agree with me that the outbreak of COVID-19 in even other African countries like Ghana happened after the outbreak was recorded in Nigeria. I think the outbreak was recorded in Ghana on the 14th of March, and as against what it was in Nigeria on the 27th of February. So the outbreak in Ghana occurred about 2 weeks after the outbreak in Nigeria was recorded. So in this period, in this 9 weeks since the outbreak was recorded in Nigeria, Nigeria has virtually, as at 3 days ago when I checked, tested only about 7,100 people, all in all. And Ghana has tested over 60,000 people in this period of the outbreak. And so and
Ghana has a smaller population.
Yes, Ghana has a population of just about 30 million, 32 million or so, and compared to Nigerian population that's about 200 million people. So if we are to go by the rates that Nigeria is expected to test people, if Ghana is to be the standard, we will have expected that Nigeria tests as much as 240,000 people in these 9 weeks. But what we have is that they have tested just about 7,000 people. It's clear now that they need to do more because this disease is beginning to spread into the community, and that is the phase we have always been afraid of. So I want to enjoin all those that have been working with the federal government, the state, and all other stakeholders to do more, because obviously we are not doing enough. And if we do not step up our response against this fight, it will get to a point where we may have to be battling with the situation because our health system, for obvious reasons, does not have the capacity to cope with this outbreak.
Right. Now, in terms of this being reflective of a sort of selfishness and lack of concern on the part of state governments, federal government, etc., government officials, couldn't we draw the same conclusions about the attitudes of resident doctors themselves who have gone on strike in the middle of the pandemic over a quibble about whether they were paid their full entitlements or not? I mean, that could be seen as a sort of callous and uncaring, attitude on the part of doctors and a violation of their Hippocratic oaths.
Thank you. Well, I am not aware. I'm the national president, and I'm not aware any center has embarked on an industrial action on the basis of non-payment of allowance or whatever.
Well, I mean, your doctors in Abuja did that. We had the guy who's the president of the Doctors Association.
That was before the outbreak became prominent in Nigeria.
The outbreak had already started.
Well, I want to explain that too. What happened in Abuja was not about the allowances and salary. It was about an injustice that was meted against them. And I want you to understand that this strike was suspended immediately after the president of the Nigerian Medical Association gave the directive that the strike be suspended.
Okay, I'm just going to ask you to, I'm sorry to interrupt you, but we must take a break. We'll come back and we'll continue to talk. You're watching the Arise interview, plenty more still ahead as we continue our chat with the president of the Nigerian Association of Resident Doctors who are on the front line of the fight against COVID-19. Stay with us. Welcome back to the Arise interview. I'm Charles Enyekolu. Now, previously here on Arise News, we've spelled out some of the economic damage done by lockdowns in Africa and worldwide. Well, another reason why the speed at which getting society back to some semblance of normality really matters is the impact on our mental health, because the lockdowns may be saving hospitals and the health system from being overrun, but all the evidence suggests that they are not generally helping our mental health. All those measures, all those people who are isolated at home and in quarantine are likely to suffer psychological symptoms, according to mental health specialists. They say there is a high risk of acute stress complaints, but also feelings of insomnia, anger, irritability, and depression. And this psychological burnout and stress also affects frontline health workers, especially doctors and nurses. And with me in the studio, Dr. Aliyu Sokumba, President of the Nigerian Association of Resident Doctors. Thank you for staying with us. And you were finishing a thought about the fact that some doctors went on strike.
Yes, as I was saying,
during the pandemic.
Yes, the doctors in Abuja embarked on an industrial action which was immediately and unconditionally suspended for the sake of the COVID-19 outbreak in Nigeria. So the point I'm trying to make right now is that as we speak right now, we do not have any hospital that has embarked on an industrial action for the sake of allowances or money. Not because these excuses are not germane, but because we think it is insensitive of us to at this point embark on an industrial action. And I want to make this clear that in the past we have been embarking on an industrial action as part of our measure, the last resort, to get governments to realize the rots in the health system. This rot ranges from the challenge of the human resource for health in our health institutions, the inadequacy of healthcare workers in our hospitals, which is at the moment we are having about less than 40,000 healthcare workers, doctors in Nigeria. And if you do the maths, it amounts to one doctor to about 6,000 populace, which is against the World Health Organization's recommendation of one doctor to 600.
So you're clearly overworked.
So we're obviously overworked, and we have been bringing this up to the attention of those that are concerned to do something about it. We have also been contending with the problem of inappropriate remuneration, which we have been battling with in the past. The Honorable Minister of Labour just made a statement 3 days ago that the hazard allowance of 5,000 naira, which is obtainable today, was what was obtainable in 1991. So you can imagine for how long we have been battling the same issue. Please review our hazard allowance, review our hazard allowance. You can imagine that's the hazard allowance that has been in place since 1991.
So does that mean they're going to review it now?
Well,
he's made that point.
The Honorable Minister said in his interview that will be done after the COVID-19 outbreak. And we are worried that the Minister is considering reviewing this after the COVID-19. One would have thought that this is the most appropriate time, not just to review hazard allowance, to overhaul the health system. And we're worried that even as the COVID-19 outbreak is going on, our hospitals have technically remained the way they were even before the outbreak of COVID-19. I can categorically tell you that though emphasis has been paid to hospitals that are currently managing COVID-19 patients, that's talking about centers that have been designated treatment and isolation centers, but other hospitals have been abandoned. They have remained the same way they were even before the COVID-19 outbreak. So this is the time for whoever is concerned about the health sector to overhaul the health sector.
But is this really the time? I mean, we're in the midst of a pandemic. Obviously, the government doesn't have enough money to do the kind of across-the-board reform and, change that we need. I mean, they have to prioritize, and the priority right now is equipping hospitals that can centers that can deal with COVID-19. It makes logical sense to say that after we've dealt with this immediate emergency, we can then worry about, yes, we need to review our health system, because clearly we've seen that these sorts of things can happen. And I don't think it's limited to Nigeria. Every country in the world is doing the same review.
Yes.
Modern countries are saying they don't have enough equipment, they should have thought about this earlier, they should have done this, that, and the other thing. I'm not giving the Nigerians an excuse, but I'm saying that maybe the focus ought to be on COVID-19 right now, and subsequently we can then look at other things.
Yes, the health system is the system that will also attend to the COVID-19.
Yeah.
So the health system I'm referring to here is not just salaries and the rest of it. I'm talking about overhauling the health system.
Right.
The COVID-19 designated treatment and isolation center is not the only component of COVID-19 management. Remember that patients do not just find themselves in isolation centers and treatment centers.
Right.
They first present in other peripheral hospitals before they are identified, evaluated, tested, and eventually they are moved to isolation and treatment center. So if you continue to let our hospitals remain the way they were, that means they will not have the capacity to identify, evaluate, and eventually refer this COVID-19
That's a
patient to
good
the
point.
appropriate
Let me
hospitals.
just also get your thoughts, because I mean, you are a doctor.
Yes.
And doctors tend to evaluate the whole of the person, both
Yes.
your physical ailment and the impact it's having on you psychologically.
Yes.
What is your sense of the psychological vulnerabilities that people are exposed to as a result of not so much being, diagnosed with COVID-19 itself, but as a result of the other things, the lockdowns, the isolation, and all of that is happening right now?
Unfortunately, these other consequences of the COVID-19 outbreak are what we have to deal with while the COVID-19 lasts. And that's the more reason why it's important that all hands should be on deck to ensure that the COVID-19 outbreak is ended in the shortest possible time. And we are of the opinion that to do this, those stakeholders that are concerned with the management, identification, isolation, and treatment of this COVID-19 management will have to do more. We'll have to do more testing. By doing more testing, more people will be identified. By identifying more people, they will be isolated from the rest of the population in good time, and thereby preventing further spread of the disease.
Yeah, but you're still going to have the rest of the population, the populace, locked down in the meantime, which is why they're doing this, to relieve the impact it's having on the healthcare system, to keep people away so they can be contact tracing and all that. And what I'm wondering is that, I mean, this country and a lot of other countries have had a lot of people already with psychological vulnerabilities, or people with, drug addictions or other addictions, or people going through divorce and who abuse their families, It's not a lot of fun for those people. I mean, do we ignore the psychological cost of this lockdown at our peril? And that also includes doctors and nurses who are in the front line. I mean, it must be having a terrible psychological effect on them when there is really nothing they can do for a lot of these people.
Unfortunately, these are the consequences that come with the outbreak of the disease. So as I mentioned, that the best way to end these other consequences will be to end the disease itself, the outbreak itself. So all measures at this point should be geared towards ensuring that the outbreak is ended in the shortest possible time, so that people can be relieved of all these other consequences of the outbreak in the country.
Yeah, but how are you going to end the outbreak when you haven't there's no medicine to treat it, there is no vaccine to prevent it? So what I'm saying is that the only prevention we know at the moment is isolation, quarantining, that sort of thing, beyond the medical things like, ventilating and people and so on and so forth. And I'm wondering because we worry about it, I mean, we worry about the effects on all of us psychologically. I'm also concerned that another area that has not been fully assessed is the stress and psychological burnout that can happen to, frontline healthcare workers like yourself.
Yes, unfortunately, this is happening. So I need to make a clarification on ending the COVID-19. The lockdown is a measure that is being put in place to buy time to identify people that are
contact tracing, all of that.
And all of that.
Yeah.
So by the time these people are identified and they are isolated and treatment is instituted in good time, and of course those that will recover, and those that will, unfortunately, the few percentage of those that will die, and then that way the outbreak will be controlled. So the lockdown itself is not a treatment modality. It is just a measure to buy time to institute other measures to ensure that the outbreak is ended.
But that lockdown in itself is having its own impact.
Yes, so that is why we have to all work together to see that all these other elements that comes with the lockdown are hastened. The contact tracing, more testing should be done, more people should be identified, and appropriate treatment should be instituted, so that by the time we're able to do this in good time, the lockdown can be lifted and people will be free of the consequence of this lockdown, which includes the mental burnout, as you mentioned.
But do you think that doctors, for example, and and so on, who are going through, because I mean a lot of doctors have talked about the stress
Yes.
of having to hold people's hands, for example, who are dying. Their relatives can't be there because they're not allowed to come and see them. You see what I mean? And the effect of having to do all that and work long hours without really being able to offer that person any kind of, there's nothing you can do. I mean, the person's dying or whatever. I mean, do you think doctors also should have a sort of mental health aspect to the treatment of all of this as well?
Yes, for doctors, we have had to contend with this reality as part of our calling. It's not new to our profession because of the outbreak of COVID-19. It is what we have always been contending with as professionals. So what would be appropriate is that measures should be put in place to ensure that the effect of this burnout, the psychological stress on workers, be reduced to the barest minimum. And one of the measures we think can go a long way in seeing to that reduction will be to have the appropriate number of healthcare workers so that we do not have to contend with the burnout. And so if we have adequate number of healthcare workers in our various institutions as against the gross shortage we have at the moment, that would go a long way in reducing the burnout healthcare workers go through.
Okay, let me ask, I want to thank you very much indeed, but let me just ask you to stay with us because we may need to talk with you again. You're watching the Arise interview, plenty more still ahead, including we'll get a snapshot of what isolation looks and feels like from the perspective of one top African Caribbean journalist. Stay with us.